Ethiopian Health Minister Dr. Mekdes Dava emphasized the national ownership and sustainability in healthcare delivery. Her emphasis was observed during the recent opening ceremony of the International Conference on Primary Healthcare 2025, commenced recently in Addis Ababa, drawing global health leaders to tackle the pressing need for resilient, people-centered primary healthcare systems across low and middle-income countries. During the occasion, she presented Ethiopia's remarkable progress over 2 decades, citing the substantial reduction in maternal and child mortality rates, framing these achievements as life-saving and families strengthened rather than mere statistical improvements.
And over the past 2 decades, Ethiopia has made remarkable progress in primary healthcare and healthcare in general. Maternal mortality has declined. If you look back in 2000, we had a maternal mortality of 871 deaths per 100,000 live births. The recent estimate is around 195 per 100,000 live births of maternal mortality. This is from the UN estimate. We have just done our Ethiopian demographic health survey, and data are going to be released very soon. And the results are really encouraging. We have constructed at a national level with 70,000, more than 70,000 community health posts. This is, I'm just naming the numbers from government's investment, but we also have private sector-led institutions, even at the primary level. We have reached to the most remote areas with this approach, and we have established over 4,000 health centers and more than 450 primary hospitals through only the government's investment.
The minister attributed these gains to Ethiopia's robust community-led approach, highlighting massive national investments, including the construction of over 70,000 community hospitals and the implementation of community-based health insurance system, by now covering 80% of the population. Professor Mohammed Janabi, World Health Organization's regional director for Africa, praised Ethiopia's primary health care commitment, describing the nation as a global knowledge hub and exemplar of community-led innovation.
Ethiopia has been long a pioneer in primary health care, from the visionary health extension program to the establishment of IPHC. Ethiopia is a global knowledge hub. You have shown how community-led, innovative, and people-centered approaches can transform health outcomes. This leadership was reaffirmed last month when WHO designated Ethiopia at maturity level 3 in our global classification of national regulatory authorities, joining only 9 African countries to reach this milestone. It signals a stable, integrated system capable of authorizing medical products, conducting markets, surveillance, and monitoring safety events.
Dr. Abnet Zelleke, Executive Director of the International Institute for Primary Healthcare Ethiopia, emphasized the conference's action-oriented approach.
This year's theme is Advancing Primary Healthcare in the 21st Century, Putting People First. This is not just a slogan, it's the standard with which we hold ourselves throughout the conference and hopefully beyond. For us, primary healthcare is not an abstract policy idea. It's a proven foundation for effective and equitable health systems. We have seen its power in remote communities where a community health worker is often the first and sometimes the only point of contact within the health system.
He described primary health care not as abstract policy, but as a proven foundation for effective and equitable access, citing community health workers who often serve as the first and sometimes only point of contact within health systems. The conference underscored the global recognition that without strong primary health care foundations, neither universal health coverage nor health security can be effectively achieved. The 5-day conference is co-hosted by Ethiopia's Ministry of Health and the International Institute for Primary Health Care, Ethiopian News Agency reported.